HIV is a viral infection. This means that it all starts with a single virus. The human immunodeficiency virus attacks and destroys the body's CD4 cells, which coordinate the body's immune function. Then, the virus rapidly replicates once cells are infected. HIV is primarily transmitted via unprotected sex. However, in 10% of cases, it can also be transmitted through blood. For example, by blood transfusion, contaminated needles, as well as pregnancy and breastfeeding. There are different phases to HIV AIDS. First, there is an acute phase right after the infection, during which viral levels are extremely high and the patient is very contagious. This phase usually lasts a few weeks. Then, for the next few years, there is a long asymptomatic phase during which viral levels are lower. The patient typically feels no symptoms and is less contagious. Over time, however, an untreated patient with HIV becomes sick. This is what we call AIDS. Patients begin to develop opportunistic infections and cancers as a consequence of their immune system deficiencies. Finally, without treatment, HIV-infected patients usually die within 8 to 12 years. Fortunately, people don't die from HIV as much as they did a few decades ago. Thanks to antiretroviral treatment, or ART, people who have been infected with HIV can now live longer, healthier lives and avoid transmitting the virus to others. The sooner the virus is detected, the quicker the treatment can begin. In the world today, there are about 38 million people living with HIV. However, out of these 38 million people, 20% do not know that they have the virus because they have not been tested. Many people avoid getting tested because of discrimination and stigma. Those who are infected with HIV without knowing are more likely to transmit the virus to others, such as their sexual partners. As health professionals, we have the responsibility to abolish the stigma around having AIDS. Reducing discrimination and encouraging systematic testing can help save lives.